You're listening to the Better for America podcast, presented by AMAC, the Association of Mature American Citizens.
Hello, everyone. I'm Rebecca Weber. This is your AMAC podcast, Better for America. Today, we have with us a published author and current director of the Right on Healthcare initiative at the Texas Public Policy Foundation, our friend, Mr. David Balat. David Balat is someone who has really done it all, or almost all anyway, it seems to me. He has been the chief executive at a hospital and knows a lot from finance to biology. He ran for Congress in 2018 and runs a successful company today. We're just so grateful, David, for your time, your energy, your patriotism. So welcome to the show today.
Oh, thank you for having me. I'm always, it's always a pleasure dealing with you guys at AMAC, your members, the leadership. Your entire team is nothing but professional and passionate and focused on what it is that you want to do for the seniors of America. So thank you to you as well.
David, thank you. Well, you have spent the better part of your life in the areas of healthcare and business administration. So I do want to start kind of broadly, and then I do want to narrow the conversation. As you look at America today, we see this runaway inflation. We see soaring costs for healthcare, for energy, and everything from gas to groceries. But what seems like really an uncaring amateur leadership, when it comes to economic policies and the massive federal spending. AMAC members were against the $1.2 trillion bill. And so we're seeing that the government is adding trillions of dollars to our nearly $30 trillion national debt, which is, it's hard for me to even imagine how many zeros are at the end of that number. And these policies are just not good. They're shutting down the energy sector. It's affecting transportation, agriculture, and virtually all areas of our economies. So I want to just ask you very broadly, in your opinion, we know AMAC members are worried, especially seniors on fixed incomes and those who are barely making it. Are things from your perspective as bad as they look? And what, in your opinion, are you viewing as some of the major threats that we're facing?
I hate to be the bearer of bad news, but I think that it's worse because it's as bad as it looks because we can only see the tip of the iceberg. And there's so much more that lies beneath the water that people don't even know about. You talked about energy independence. Well, you talked about energy and the cost of energy. And it's really a shame that we went from energy independence to now we are actually asking OPEC and Russia to produce more so that we can bring down the cost of gas. Gas and groceries are what really are the dominant issue in this country. People care about how much money that is being spent. And inflation is absolutely a tax on all Americans. The spending by the Biden administration has just been unrestrained. We had quite a bit of it in the Trump administration, but it has just been in overdrive now with the Biden administration. And if we're going to spend, if we're going to continue to do what's right for this country, we have got to get our spending under control. That's without question.
No doubt. I mean, and our members are concerned that we're sort of in uncharted waters because I've never seen things this bad as far as the economy goes in the future, and our concern about this unchecked runaway spending. Are we headed back to Jimmy Carter style stagflation, in your opinion? Is that coming?
I certainly hope not. I don't want to see 14, 18% interest rates. That's not the America I want to get back to. And if that is a comparison that we want to make, I also want to provide some optimism and hope that we did after a Carter have a Reagan. And there was an opportunity for us to reform and get back to our roots and our first principles. And that's something that I do a lot of in the different work that I do, both with the Texas Public Policy Foundation and with Free to Care. We are running low on hope. And I hope that after watching this show today, that people will come away saying there is a light at the end of the tunnel. There is a glimmer of hope.
I believe there is.
That glimmer is getting
we are
larger
hopeful.
and larger.
It sure is. And, it's amazing how a few good people can make all the difference in the world. And there are so many people that are really focused on doing what's right. And really you being one of them, David, and a friend of AMAC's, our members really do appreciate the value that you bring, because I want to turn to healthcare. Truly, so many folks are concerned about our healthcare system. My father, Dan Weber, who formed AMAC, he would always say to me, Rebecca, America has the greatest healthcare in the world. We do. And it's because of the innovation. It's because of the men and women who go into the healthcare system and provide services and take care of our people. But the innovation and the ability for people to say, you know what, let's do this research, right? And to be able to have that freedom in our great free country. So as you look over the horizon, how concerned are you for the affordability, the sustainability of our current healthcare system? What is the viability of US healthcare in terms of, and how are doctors feeling about what's going on? Is the younger generation looking at getting involved in healthcare? As at one point in time when I was a younger woman, I like to think I'm still a young woman, but when I was a younger woman, folks that went into healthcare, you thought, wow, you're going to have a great career for you. Today, people are afraid to get into the healthcare system because the opportunities don't look as ripe. What are your thoughts there?
Well, many medical professionals are leaving the industry. Physicians are going to find something else. They're going to retire. We have an incredible number of suicides amongst physicians. I think that they were, last I saw, they were number 2 behind veterans. They're not telling their children to go into medicine. They're saying stay away from medicine. And so we're seeing less people go into that field that was once so revered and respected. So I worry because the younger folks now don't want to go into independent practice. They want to get hired by a hospital or a private equity group. And if any of them were to hear this, I would say, do what you can to not do that. You will be more fulfilled. You will do and be a part of practicing medicine and doing that for which you trained so diligently and so hard for. Whereas working for a corporate entity, you will be a cog in a wheel. And there's a lot of moral injury that is being suffered by physicians and nurses. And that's why we see so many of them exiting the field right now.
Yeah, I mean, you certainly don't need the federal government in the, patient-doctor relationship. Doctors care so much about their patients, want to spend that time, that one-on-one time developing those relationships. I mean, they're so meaningful and important. If you don't have your health, what the heck do you have? And here we have a government that's really trying to dictate, a lot of things, and insurance companies that are deciding, how much a doctor will be compensated, and all of these things, these regulations, these constraints, I see it impacting doctors, and I see how more doctors are interested in getting involved in what is a very interesting concept of direct primary care. Can you share with folks a little bit about what direct primary care is and how it's different from maybe your traditional, purchasing a traditional health insurance policy and seeing doctors in network? How does the DPC is another acronym we use for that?
Yeah, direct primary care is actually an old idea with a new twist. You hear about the old country doc that would come to your house with the medical bag, or that knows everybody in your family and is able to take care of you because they know who you are. Direct primary care does that today, but with a technological twist. They use telemedicine widely. Initially, they get to know you, and much of that can be managed remotely after that. But rather than using an insurance card, direct primary care is just that. It's direct. Both the clinical interaction and the financial interaction are direct between doctor and patient. There are no middlemen. There's no government. There's no insurance company. There's no pharmacy benefit manager. There's no group purchasing organization. Name the acronym, and they're gone from that relationship. It's only the two stakeholders that really matter in healthcare. And so, for a low monthly rate, consider it to be something akin to Netflix. So you pay Netflix, I don't know what it is nowadays, $10, $11 a month, and you can watch none of it, or you can watch everything that they have, and it's still the same amount of money. It's the same with direct primary care. You can talk to your doctor as often and as much as you want, and it's the rate does not go up. So it
you're
really
paying
is
a monthly fee, in a sense, to have the access to your doctor, and a scheduled fee, a scheduled list of other services and their fees that go along with that are included with your monthly membership fee, I guess you could call it. It's quite interesting. And I think a lot of those doctors have had tremendous success in retaining their patients, providing better care because they can spend more time with those patients because they're setting the fee, the costs, essentially.
It's the only model that grew during the pandemic. Doctors' offices around the country were shutting down. Hospitals were shutting down. The only group or the only business model in the healthcare industry that grew was direct primary care. And that goes to saying something, because people were losing their jobs. They didn't have access to their insurance anymore. They wanted to get care. They wanted to feel, they wanted to have a peace of mind. And they also wanted to be in charge of taking care of themselves and having that oversight or that relationship. So that's when you saw so many doctors who were either forced out or decided to leave the hospital because it wasn't the kind of practice, and it wasn't the kind of the practicing of medicine that they wanted to be a part of. So they wanted to be in charge of how they deliver care to their patients. So you've got two stakeholders now that are in charge of how they want to be involved in this relationship, and they do it directly.
Right. Very good. Thank you, David. That's great. For people who want to know more about direct primary care, is there a website or any resources that we can point them to? We'll get them up on the screen here. You can be happy to share them because, I personally have a number of friends that are direct primary care physicians, and I hear nothing but good things. So it's a great alternative for people.
And I will,
David, thank you.
And if I may, I want to talk about something that's
Sure.
even more exciting. It's direct primary care, but DPC is taking on a new name, or it's the acronym for something else, direct patient care. Now we're seeing specialists who are also tired of the industry and looking at their primary care brethren and saying, I want to do that too. So now we're seeing rheumatologists, we're seeing cardiologists, we're seeing all these different specialists. An oral surgeon I just met in San Antonio. There's an ophthalmologist that does surgeries for pennies on the dollar, less than what you would pay out of your own pocket in insurance. And they're also seeing people on Medicaid and Medicare because those programs are either not authorizing it or they're delaying the ability for them to get care. So we're seeing this continue to grow, and I'm a big proponent of that, because the more we have in the way of independent physicians, the better off we are in our healthcare system.
Amen to that. The free enterprise system always works best, and that's what we're supporting here. So thank you, David. I do want to switch gears here and take us into a little bit more granular politics, the day-to-day issues that many Americans see and that you've seen up close. So I do want to ask a bit about your run for Congress and the courage that running for office, whether you're running for a school board, whether you're running for Congress or president, what does it take? So if you could tell our membership first why you decided to run for Congress, how you looked at that process, and perhaps offer some encouragement to those people who might be thinking about how to do their own part. People that are listening may want to run for their school board or somewhere for Congress. So start by telling us a little bit about the why and how.
Why? I was not involved politically at all. I was a hospital administrator, I was a business owner, involved in my community and my church. I was approached. I was also very dissatisfied with how the business of healthcare was being conducted, and I was a part of it. I was a part of that sense of dissatisfaction. I didn't know what I could do, although I knew what some of the right solutions were. So when I was approached, I immediately laughed and thought, well, I don't. That's not something I would even consider. And it was interesting. The response of the people that approached me said, well, that's why we think that you're exactly the right person, somebody who doesn't want to be there, but wants to change things. So I appreciated that, and I considered it and gave it some thought. And I ended up deciding that, I wanted to be a part of the solution. And healthcare obviously is a big component of my why, but there are a number of other issues like immigration. I'm a child of immigrants, and the economy itself. So I decided to run. It was an interesting experience. I would encourage everybody to try it, whatever level. You don't have to run for Congress, run for city council, your school board, your HOA. Do it. Get involved. Just be a part of the process. It will really teach you a lot about yourself. So it's a fascinating process. If you don't do it yourself, be a part of a campaign. Be a part of somebody else's effort. Go block walking. It is fascinating. The experiences that you will have meeting other people and the questions that you'll receive. And it challenges you because you have to be able to know what you believe and why you believe it and be able to convey that in a way that people are able to understand. So I would highly recommend being involved.
Oh, that's great. Thank you for your candor and for sharing your experiences, because it's beautiful how in this country, if you really want to do something and you put your mind to it, you can do it. And, for folks that are listening that want to do something, but maybe don't have the time or the resources, you can get involved with AMAC. You really can. We give folks the opportunity to participate as an AMAC delegate or AMAC chapter leader. We give you a toolbox. We give you a ton of information. For more information, for people listening that want to get involved in their local community, and you'd like for AMAC to give you sort of guidance and prepare you so that you're armed with the knowledge on the issues, go to amacaction.org, and check out the information there. Because David, I applaud you. This is what's great, is when you see something, we can do something about it, and each and every voice can make a difference in America. That's what I love about this country. I do want to turn a little bit to some of the bigger issues, David. Go ahead. Did you want to add to that?
I wanted to say something about AMAC Action and the delegates.
Yes,
the very first,
we love
the very
them.
first
They're great.
debate, the very first forum I was a part of in my primary. There were 9 of us in our primary. It was an open seat in Houston, Texas. And the very first forum was an AMAC forum. And I'll tell you that of the 30, 40 people there, I can't remember, it's been a few years now, they asked the toughest questions. And I was actually thankful for that because they were all healthcare questions. So I did very, very well.
You did great. That's wonderful. And yeah, they're very knowledgeable people. And, we like to arm them with the facts and the issues so that they know exactly how to ask questions and what questions, are going to get, their voice heard. We're doing a lot. We're working, for example, Medicare Part B. What a shame that the, folks that are living on fixed incomes are seeing the biggest increase ever that I've seen since I've been in the business.
And it really, it irks me that they're saying, well, it's okay because the cost of living adjustment will basically eliminate the increase in the premium. But you know the reason for the increase in the premium in Medicare Part B, which, as we all know, is for professional services, seeing a physician, outpatient services. But then in the very next sentence or the very next breath, they explain what the increases are due to: COVID hospitalizations and drug costs. Well, hospitalizations are Part A and drug costs are Part D, yet they're going to penalize Part B. That's not how that should function. And it's really just, I'll talk about disinformation. It's not because of the increase in the Part B outlay. They're robbing Peter to pay Paul, essentially.
Thank you for saying that, because those were my thoughts exactly. It doesn't make a lot of sense. And the A, B, C's, and D's of Medicare. The government can't fool us. They want us to believe that it's a justified increase when in fact these are folks that are living on fixed incomes, many on Social Security. They're not seeing the same cost of living increase in their Social Security check, that's for sure. So, we're seeing these big issues nationally, and we're seeing. I do want to turn a little bit to some of the big issues, other big issues that we're facing. For example, our southern border. We see rising crime rates. We're seeing people come through the southern border unvaccinated. Of course, we know that the administration wants to help pay them so that they do get the free health care and even extra money just to come over and be here. And then we see how people are struggling here in America. But the southern border, we see the crime rates that are just out of control. Our record drug overdoses in 2021 I was shocked to see that the statistics, more people died of drug overdoses in
Right.
21 than they did in 19 and 20 combined. And then we see the problems in our educational system with critical race theory being taught to our youth. Democrat efforts to defund police and even brand parents as domestic terrorists, which is why I think Youngkin and Winsome Sears did so well in Virginia. Parents are stepping up, parents are stepping up and speaking out and saying, these are our children. We have a right to know what they're being taught in schools. What do you think are the most serious issues before us today? And how do we get back to common sense and accountability at the federal level and put some limits on government? Loaded question.
I think no, it's a good question. And I want to take this, I want to address it in the most fundamental way that I know how. All of these policies, all of these mandates, all of these regulations infringe on our individual freedoms. It's important that people recognize what their role is in this country and what the role of government is in this country. Government exists to protect our rights. Our rights don't come from government. Our rights are inherent in our humanity. They're given to us by God. And when government asserts itself in such a way that they want to rob us of our freedoms, we have to stand up and say no. We have to, and we saw that in a very real way in Virginia in that election. And I hope that people recognize that elections matter. Now, that's not to say that this party or that party is not going to do something that's dumb and harmful, because I think we have to be vigilant regardless of party. We have to be the ones to hold our elected officials accountable. And I really do appreciate the work that AMAC Action does, advocating for your membership, because you do a great job. Holding members of both parties, holding their feet to the fire to protect those freedoms that we hold so dearly as Americans.
Yeah, boy, that's really great. And folks do need to recognize, I think that's the biggest difference as I listen to the news, and I like to watch and hear both sides. I think that the ideology of the left is that government is good for you, bigger government is better, and that you need to be dependent on government to help you make choices in life, where I think what we're saying, David, and what we agree on is government doesn't really create anything. It's there to protect us. We, the people, put government in a position to protect our country, to keep our nation safe, and to strengthen our military, and to help with those issues that impact all of our states, across our great nation. But it is not there to tell you how to live, how to eat, how to, what shots to take, what masks to wear. I think that is just extreme government overreach. And I do think that this leads us into my next question, because as a businessman, you really see the stress on businesses and small businesses, especially today. The U.S. economy really depends firsthand and foremost on the private sector. And we know that government does not produce things. The private sector produces things, yet we're seeing increasing pressure from government on small businesses. Now, the founders wanted limited government. How important is it that we preserve freedoms for small business, allowing them to prosper and to make their own decisions, to hire the employees that they want, et cetera?
Well, I think you're seeing how that's bearing out. The states that have such overreach in the way that they're regulating both the people that live within that state and their businesses, you're seeing them leave. I live in Texas. We're getting 1,000 new residents a day. We hear about a new company's headquarters moving to Texas regularly now. There's a concern for our infrastructure with all of this growth, but people leaving New York and California to go to Florida and Texas. Why is that? It's because of a limited government at the state level. And I think I know that at the federal level, if we were to do that, it would rise all tides and help everybody. But the private sector needs to be allowed to serve its customers, its communities, and its employees, and allowing them to make the decisions for themselves. Because when you're forced under compulsion to mandate anything, you stand to lose customers, you stand to lose employees, you stand to lose lots of things. And why would government be in the business of harming small business, as you said, is the engine of our economy?
Yeah. And, you know, for folks that are small business owners listening, we know, and they know how difficult it is to maintain a small business, and, you know, the risks that are involved in creating and starting your own business, the both, you know, your money perhaps that you've used to start up your small business, and building a product or competing with someone, whether you're cutting hair or selling pizza, or offering some sort of consultative service, or if you're the doctor, whatever it is that you're doing, you're waking up each and every day and you're thinking about your customer, and you're thinking about how to offer value to people in return for money. And in doing so, when you build that and you offer great value, you attract employees, you hire employees, and you really are the small business owner really is the fuel to our economy. It frustrates me deeply that I see an administration that is imposing so many mandates on small business, almost wishing that they could mandate that business owners take it upon themselves to ask for personal health information, health records, force people to take a vaccine that is experimental. And believe me, all of us here at AMAC, we're pro-vaccine, you know, get the vaccine. We're all for that, but it's a decision between you and your doctor. And we think it's wrong for the federal government to mandate that everyone must take this vaccine without exclusion. It's really extreme overreach. So I appreciate your perspective here, David. That's really good for people to hear that. Go ahead.
The Attorney General here in Texas is actually suing the administration regarding the Medicare, the CMS mandate on hospitals. And how that's playing out here in Texas is that a lot of our rural hospitals, they have a 60% vaccination rate. And if they don't have the rest of their staff vaccinated according to that mandate, they will have to either shut their doors because they'll lose their Medicare reimbursement and their Medicaid reimbursement, transfer all those patients to other hospitals that are already busting at the seams. But they're creating an environment that is already so strained. They're exacerbating that whole situation and taking a strained situation and just blowing it up. And so the Attorney General is suing the administration. The Texas congressional delegation is putting together an amicus brief, and and I've talked to them, and from my perspective, having worked in the hospitals, safety is always important. We go through training, we provide equipment, and yes, we required vaccines, but it wasn't a requirement without the possibility of exceptions. Even a flu shot, it's one of those required vaccines that you have to have. But if you didn't want to take it for whatever reason, you had to have an N95. It had to fit correctly, and you had to wear it whenever you were in the presence of patients. Why can we not do the same thing now for this situation? Why is this so dramatically different than the way that we've handled things for decades and decades?
That's a great point. Really good point. And we're talking about our essential workers and those folks that were held as heroes just a year and a half ago or a year ago before we had a vaccine. And today now they're being really targeted and treated as second-class citizens. So this is a really good point that we've done things for so long a certain way. We ought to go back to what's worked and look to unite the country and bring us together, not further divide us. David, thank you so much. David, I have one final question. I think people are going to be really interested in this. Can you tell us a little bit about the letter that was drafted by 20 Democrats that was addressed to Democratic leadership? And this is relating to the non-Medicaid expansion states. Can you fill us in? What do we need to know about that?
It really is very quite, it's very interesting. The 12 states that have not expanded Medicaid, 20 Democrats in the House of Representatives signed their name to a letter that said, Speaker Pelosi, we want Medicaid expansion. We think it's great. We've tried our best to do it. But the way that you are looking to pay for it in the Build Back Better Act is actually going to harm the hospitals in our state. And their words were, this would be a disastrous transition. It's taking money away from MD Anderson, the preeminent cancer facility in the world. It's taking money away from Texas Children's Hospital. It's taking money away from county hospitals that serve the poor. It's taking money away from the rural hospitals. This is how they look to expand their ACA crown jewel. They want to take money away from the hospitals that are doing the work, and they want to put it into a government program that really incentivizes and rewards insurance companies. So what did they do after saying these things and saying them rightly? Honestly, they were not wrong. It would be disastrous. They submitted that letter, nothing was done, and they voted for it anyway.
Unbelievable.
I agree.
You know, it just, it's one thing after the other with the administration, with Nancy Pelosi and the rest of the group that are sort of blind to the big picture and how these decisions are going to hurt America. Let's pray that we can undo some of this in the future, and for a 2022 midterm election that really, puts more conservatives in seats in both houses. David, thank you so much. Your experience and your commitment to the greater good is so appreciated. We appreciate what you do for America, and you are certainly inspiring to speak with. We love that you have such a strong willingness to take risks for other people and for the country. And it's a great lesson in really what makes this country so great, people like you. AMAC members appreciate your great leadership in business and government and the community. So to all of those listening, know that AMAC continues to fight for the values that make America great, for our Bill of Rights, for the American dream, and for the future. And we hope to see you again soon, David. I know you'll be back with us soon.
I hope to soon. Thank you very much.
Excellent. Well, thanks for being here. And I want to thank everybody who's tuning in today. If you have not downloaded the AMAC News app, you can watch and listen to today's podcast plus track breaking news here. Please make sure to hit the subscribe button, follow, like, and share wherever you are on social media. Until next time, everyone, I'm Rebecca Weber. This is your podcast, Better for America. Thank you for being here, and God bless you. Have a great day, everyone.
Thank you for listening to the Better for America podcast. To learn more about AMAC and all it has to offer, visit us at www.amac.us.